Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. Joining us today, we have Cindy McClure. She is the owner here at Southern Cosmetic Laser. So excited to be here. Always a pleasure to come and visit. Thanks for having us.
Glad to have you.
All right, so we're talking about sun damage.
Yes.
Which, I know for myself, I wish years ago I would have taken better care of my skin. Exactly. But when it comes to you always have all these different gadgets that can kind of make up for years of not taking care of your skin, right?
Oh, and I can definitely empathize with all, because I have plenty of sun damage. Being a farm girl, we didn't wear sunscreen and we weren't smart about it. So the damage is done in our 20s, but wanted to focus on just a couple of technologies and that people, here in the South, sun is 12 months out the year, but people think about it after the summer when you've been outside at the beach or on the boat. But two particular treatments, just to kind of even up that discoloration and give you a brighter tone and texture. And I want to point out that I treat every skin of color, so it's very important to be able to do that. And we live in a diversified environment. I have lots of different colored skin patients, and you can't use every laser or device on every patient. You have to be very careful. But lasers obviously are good at improving the discoloration, the texture, the tone, and then also the lasers that people who suffer from rosacea or a lot of facial vessels or the redness, that the lasers can tone down some of it. Can't cure rosacea, can't cure melasma, but definitely can help maintain it, make you have that overall brightness and improvement in the skin.
Okay, so what is the technology though, the names that you have? Of the product?
So for the laser that actually targets the vessels or the redness would be the pulse dye or the V-beam. Actually it's the Prima, it's a newer version, but it's a pulse dye laser. So that laser actually targets anything red. It's also the laser that treats children down to the age of when they have born with the port wine stains. I preferably do not treat any because those kids do not really like laser. They usually treat it at the medical facilities that they can relax those little children. The laser does not hurt, but obviously it's like a little rubber band slapping you.
For a kid,
so therefore it's pretty, even some of my males and females don't really like it. So, but you don't have to numb up for that, but it's no downtime to that laser. But it basically shuts some of that redness down. I tell patients it takes anywhere from 2 to 3 treatments probably to get you looking better. I have rosacea patients that I've seen for the last 15, 18 years, and they still require maintenance treatments because you cannot cure rosacea.
I have rosacea, and I cream sometimes it just doesn't, it stops working, so sometimes you got to take it to the next level, right?
And a lot of patients have that vasodilation, they have that flushing effect. You can't dial that out, that's an internal mechanism, but the laser can improve that overall redness. So I just sit down and talk to patients about how many treatments they need, what to expect from those treatments, and how often to maintain. As far as the discoloration, we have quite a few lasers that target that. I always like to tell patients it really depends on your skin of color and depends on how weathered your skin is which one of those technologies we would choose. I always tell patients, depending on skin types, and I talk to patients when you come in about skin types 1, 2, 3, 4, 5, and 6.
She's an educator.
Not everyone is going to get a CO2 laser and look like Freddy Krueger for a couple weeks. Most people do not want that downtime. So most people like a laser that's a little bit of fine polishing, takes several treatments to accomplish that, but very good at evening up the brown discoloration or sunspots. So have a lot of options in different lasers. I say a lot of tools in the toolbox for pigment.
And you have a lot of tools.
So, the Quadralaser is also a laser that I treat lots of skins of darker colors that's safe to even up those skins of colors as well.
So when you have dark spots, that's what you said, like?
It may be sunspots.
Okay, that's different from like a freckle or something, right?
It just depends on.
You have to really look at it through. Okay, gotcha.
And then a lot of patients here have melasma, which is that, we call it the pregnancy mass, some people call it, but a lot of people here have it and they don't even know they have it. You can't cure melasma either, you can just maintain it and balance and control it. So there are some lasers you don't want to heat up the skin too quickly, so it's got to be the right laser for the right person, for the right condition and the right skin color. So it's not just anyone can say, oh, I want this laser. you really have to assess the skin.
And that's why you have to spend time with them, right?
Right, and the medications they take. So it's a holistic view in trying to treat that patient.
All right, before we head out, I just want to know though, have you ever had a patient come in and they have something they want to do and you notice they might have skin cancer or something looks funky?
Refer out to my derm colleagues for that. I get to see a lot of skin cancers and pick it up. Which one of the lasers that I'm talking about also treats actinic keratoses, which is FDA cleared to treat some of the precancers. So a lot of us have that and don't know that. Those are not known cancers. They particularly might turn into a basal or a squamous cell, but so I also recognize
so you're able
those.
to identify those
Oh
too.
Yeah, absolutely.
Gotcha. All right, anything else we need to know before we head out?
Nope, just
Come
be
and schedule
smart,
an
wear
appointment,
sunscreen,
right?
and it's always an adventure to work on the skin.
All righty, well thanks again for
Thank you.
And for more information, head online to southerncosmeticlaser.com.